I have nothing to disclose. I'm Dr. Alex Falvo from Geisinger Surgical Institute in Danville, Pennsylvania, and today I'll be discussing emergency department utilization in the post-foregut surgery patient. As increasing healthcare costs in the United States continue to place economic strain on hospital systems, there has been an emphasis on identifying areas for cost savings. Emergency department utilization contributes a large financial burden to the healthcare system. And additionally, many of these visits are thought to be preventable. Previous research estimates that about 20% of all emergency department visits are avoidable. We believe that post-surgical ED utilization is also avoidable, and we hypothesize that many of these visits could be avoided if outpatient services were more effectively employed. While hospital resource utilization and readmissions have been analyzed after minimally invasive foregut surgery, there is little information examining postoperative ED utilization. The objective of our study was to examine ED utilization within a large multi-healthcare system following minimally invasive foregut surgery. Additionally, we sought to determine the nature of these ED visits as they pertain to the relationship of the index procedure, whether they are preventable, and if these visits could be alternatively managed in an outpatient setting. Finally, we wanted to identify areas for potential cost savings and estimate their value. Following Institutional Review Board review, a retrospective review of a prospectively maintained quality improvement database sourced by the electronic health record was performed. Patients undergoing urgent and elective minimally invasive foregut surgery were identified using CPT codes for procedures listed below. This database was queried from January 2018 to July 2019. The demographics were 72.5% female patients with a mean age of 60 years old. Patients were excluded if they had age less than 18, ASA class of 5, or revision procedures. The data was analyzed using chi-squared, Fisher's exact, and Wilcoxon rank sum testing. The chart review process consisted of identifying whether the emergency department visit was related or unrelated to the index procedure, such as a known complication of the procedure, a wound problem, or nausea, vomiting, dehydration, or dysphagia. The emergency department visit was then rated as preventable versus not preventable. This was based on the day of the week, the time of the day, and contact with the surgical team prior to ED utilization, as well as reasoning for the ED utilization. If the visit was determined to be preventable, the visit was then identified by one of the following: provision of quality care in the initial hospitalization, discharge planning, post-discharge follow-up, or coordination between inpatient and outpatient teams. A total of 458 post-foregut surgery patients were identified between January 2018 and June 2019. 92 of these patients had return trips to the emergency department within the first 90 days, or about 20%. Of these return to the emergency department, 59 patients were considered early emergency department visits between 0 to 30 days postoperatively, while 33 patients were considered late emergency department visits 31 to 90 days postoperatively. Of the 92 patients who returned to the emergency department, 44 patients, or 47.8%, were admitted to the hospital from the emergency department. Of the 92 patients who did present to the emergency department, 55 patients, or 59.8% of the patients, did attend a postoperative clinic follow-up visit prior to presenting to the emergency department. The mean time of these visits was 13.3 days. Here you can see the breakdown of ED return visits, with 25% of all return visits being in the first 7 days postoperatively, and subsequent 39% in the 8 to 30 days postoperative range, for a total of 64.1% in the early emergency department visit cohort. As you can see, these numbers continue to decrease as the patients get further out from surgery, 20% between 31 and 60 days, and 16% between 61 and 90 days. When comparing early emergency department visits versus late emergency department visits, a statistically significantly greater proportion of early visits were related to surgery, 72.9% versus 39.4% compared to late visits. 14 of the early visits were found to be preventable as compared to 6 of the late ED visits. However, there was no significant difference in these proportions. Additionally, the mean emergency department return cost did not vary between early and late visits. As you can see here, the distribution of emergency department utilization over the days of the week was very little difference day to day. 27.2% occurred on the weekends, while 72.8% of visits occurred during the weekday. And also surprisingly, 52 patients, or 56.5% of patients, returned to the emergency department during clinic hours from 8 a.m. to 5 p.m. When comparing patients who presented to the emergency department during clinic hours to those who presented during non-clinic hours, there were no statistically significant differences in related or preventable visits, as well as no difference in median ED return costs. In discussion, our study showed that 20% of postoperative patients used the emergency department within 90 days, much like other studies. Again, this represents a significant financial burden, with over 50% of these ED visits being related to the procedure and over 1/3 being determined to be preventable. Some strategies that we recommend to try and mitigate these ED visits include the use of a walk-in clinic, a 72-hour phone call, outpatient IV fluid infusion centers and home health care, patient education including if you're feeling worse, call us first, and other preoperative educational strategies to try and prevent visits. There were limitations to our study. It is a retrospective study with a small sample size, preventable visits with an N of only 20, and most importantly, there is subjectivity of the criteria that we used to determine whether an ED visit was related to surgery and or preventable, though we did base a lot of our research on previously published data. So in conclusion, our study demonstrates that most emergency department visits after foregut surgery occurred within 30 days post-op, and a majority were considered related to the procedure. However, more than 1/3 of these visits were considered preventable. Interestingly, the majority of these visits occurred on weekdays between 8 a.m. and 5 p.m., and this represents a significant opportunity for potential cost savings. We believe providers should consider implementation of strategies such as open office hours, 24/7 telephone access, telemedicine, and improved preoperative patient education in order to decrease the number of unnecessary ED visits. Thank you.